Hi, and welcome to the course on an overview of workforce planning in the overall theme, which is workforce planning. This is a training course developed for health and social care managers of various different types, management of any sort of type, working predominantly in the English NHS and care sector, but can be used by anyone, I'm sure. My name is Colin Lurie. I am a workforce planner by background, also a trainer by background, and I've pulled together these courses in workforce planning, and we'll be putting other courses together in customer service and in areas like cost control and general management skills for your use. Just before we kick off, just introduce Carados Limited, which is www.carados.com. We're a management training and development company. We build skills in all of those areas I've just talked about, and we use an approach which is partly training, partly provision of tools, and partly undertaking real work on projects to develop people. We work with Lancashire and South Cumbria NHS Foundation Trust and Health Education England to provide the WRaPT tool as well, which is relevant to this topic. The WRaPT tool is the Workforce Repository and Planning tool, which is delivered by these guys back when Dogtooth appeared to be the uniform of choice. The WRaPT team provide training and development, but they also provide a free-to-use online secure workforce modelling tool, which is at www.wrapt.org, possibly .org.uk. I'm sure you can look it up on the internet, which is pretty much what it says on the tin. It's a repository to store data on workforce and activity, but it's also got a function to help you to do workforce planning. We'll be using that tool as part of the training. You don't need to use it, but it'll be mentioned quite a lot through the training. I mentioned that training is only a part of what we do when we're developing people, and I just wanted to flag to you. It's great that you look at this course and try and build an understanding that will help teach you some techniques that you'll need, but there are a few other things you're going to need as well. Absolutely critically, you're going to need to be able to come to this with some capacity. It's not going to be doing much good just to look at the course. You're going to need time to be able to do the training. You're also going to need time to be able to undertake a real project. You need a reason to learn this stuff, a chance to practice, but also something to prove success from all the effort that you're putting into it. Otherwise, why bother? You're all busy people. A final point, you're going to need support within your organisation to be able to do this work, which is why it's important that you're doing something that's of real use. So when we are approaching development, it's not just about providing the tools and the techniques that we're going to provide through this course. You're also going to need to bring to it some time and a real project that does something for your organisation if you're really going to make this work. So please, don't think you're going to get everything from this course, but the whole aim of this course is to provide you with those tools and techniques as we go through. This module is going to focus on a few specific things. It's going to focus on what workforce planning is, and as a theme, workforce planning is going to talk about what workforce planning is. We are going to come up with a course around redesigning workforce. We'll talk about WRaPT modelling in itself. We'll talk about workforce plans, we'll talk about workforce hubs, and we'll talk about frontline workforce planning, your rostering, etc. Giving away a little bit about how wide the workforce planning topic is. This particular course will tell you about the suite of available courses. It will tell you about the WRaPT tool. It'll tell you what workforce planning is, help us to define that. It'll tell us what the barriers are, and we'll categorise workforce planning skill. Before then signposting you to the actual training courses that we're going to really need to get into the detail of. So this is an overview course only at this point, giving you that sort of high level view. So what is the WRaPT suite? What are the training courses that you're going to be able to find on the topic of workforce planning? Well, you got this one, everything you need to know to get started in it. The big one is WRaPT Redesign, which is an approach to redesigning workforce, but the approach also helps you to understand redesigning other things alongside it as well. But it's predominantly a workforce redesign approach. We're going to talk you through WRaPT Plan, which is predominantly an approach to helping you develop workforce strategies. WRaPT Hub, which is an approach, well, not so much an approach, a few elements to think about if you're working across an integrated care system and what you need to know from workforce at that system level. And at the other end of the spectrum, we're going to talk about WRaPT Frontline, which is the skills you'll need as a frontline manager. But we'll talk about wrapping that into a program which will help your executives, not just yourself on the front line, and why that's important. Finally, we'll talk about WRaPT, the model, because there is specific training on using the WRaPT model itself. So that's the suite that we're going to pick up as we go through these courses. So just there it is, www.wrapt.org.uk. That is the WRaPT tool. If you go there, you'll get onto the website and you'll be able to gain access to the tool itself. The WRaPT tool, as we talked about, has got two parts. One of it is a workforce repository, which allows you to hold a clear understanding of your current workforce and your current activity and how that workforce and activity are linked. Once you've got that, you will have a workforce baseline of some sort, which you can then do some workforce scenario planning on, and that's the second part of the tool, which is the planning tool. The WRaPT tool is a free-to-use tool. It's available online to anyone working in health and care. It is funded for anyone in health and care in England and other parts of the UK. I am sure if you want to use it abroad, get in touch via the website and we can discuss how to make it available. Fairly simple calculator, but with some really good complex calculations going on in the background. So that's the key bits, the training and the tool that are going to be available. So the course and this session, what are we focusing on? Well, there are going to be a few elements that we are going to pick up on. First one here is we're going to focus on the WRaPT redesign approach. This is the big one. So we've got about 5 or 6 courses specifically on how to go from not understanding what on earth is going on with regards to workforce to implementing a new workforce model. It's our largest course. It's focused on that redesign with or without the WRaPT tool. It's also focused in areas where you haven't necessarily yet got to a new care model. You can use it when you have or when you haven't, but it's focused around basically dealing with a situation where you say, we've got a workforce problem or we need a workforce plan. There hasn't really been much done in this area. We can take you from start to finish on that. And it's a pretty pragmatic approach to doing it. For me, it's a core skill and it's very useful experience for anyone who wants to undertake workforce planning. And it is, as I say, the big one that will be that will take quite a considerable amount of time to get to grips with. We've also got WRaPT plans. So this is it says here a short course. It's actually a short course that sets out thoughts on how to develop a workforce plan or strategy. It's really designed for anyone again, because you can use this approach whether you've got a single team workforce plan or whether you want to develop a workforce plan for a region. We're going to talk about how you can do it simply and how you can do a very complex model and a whole range in between. We're going to talk about what makes up a plan and what might a plan look like, including elements of the background, elements of what you might include to explain what's currently going on, explain the future, but also then to explain the plan itself between that. So we'll talk about that. And in the WRaPT plan section, we'll also talk about the 7 R's, which are basically the different elements of a plan. To move from your current to your future state. So it will talk about what might plans be to recruit people, to keep people, to retain people, to get them to return to work, to maybe replace the role with something different, maybe information technology like robotic process automation or AI. We'll talk about how you might need to train people. We've had to make that retrain to make it fit the 7 R's. We'll talk about the need to redesign to be able to change the need for roles, and we'll talk about how you might re-energize people in their role, which would be like a focus on wellness, etc. So there's quite a lot of interesting stuff in there. We'll also talk about, and this is stuff really valuable for me, the real considerations of a plan. Absolutely critical to me is where can we secure investment. And you will, I'm sure, at that point hear my we need more teeth theory when it comes to workforce planning. So the WRaPT plan course that we cover will cover those individual elements. How can we develop a plan or a strategy? So WRaPT Hub Plus is our focus on the various different things you need to do at hub level. When I say hub level, so I'm talking about system level type stuff here. And we'll talk about all the different elements that make up being the workforce lead or leads at a system level. Be that at an ICP, an integrated care plan, integrated care program level, integrated care system level, ICS level, STP level if they still exist. Whatever level you are that's at that runs across multiple organisations, there is a workforce role, and we talk about what the different elements of that workforce role might be. Again, it's a short course. It builds on our experience of helping set up health and care system hubs. It relates to SWIM, which is the System Workforce Improvement Model from NHS England. And it's really useful for any of those staff involved in ICS, ICP and STP workforce roles. Quite an interesting set of things to talk about there. There's WRaPT Modelling, which is a 1 to 2 day course which focuses on how to use the WRaPT modelling tool, actually how to develop those future scenarios, how to develop future current states, and also how to do all of the other malarkey that you need in order to develop a WRaPT tool. That's useful for anyone who wants to use the WRaPT tool to model workforce as part of either redesign work or if you're working within a hub. Very specific. As I say, for any of our redesign stuff, you don't have to use the WRaPT tool if you don't want to. But if you do want to get into some WRaPT modelling, it's a great tool. And there's some great training around that. Finally, I think is WRaPT Frontline, which is an interesting one in terms of a course. It's focused predominantly around what are the skills you need for day-to-day workforce planning. So it's useful if you're a practice manager, a care home manager, a community team leader, an acute trust service manager. It's useful for anyone who's running a team. We talk about things like rostering, and we can talk about job planning. We can also talk about leadership and the various skills you need to manage a team. But what we also cover is the approach to getting this used. For me, it's not just about having these skills, it's about linking them to something, as we talked earlier, within the exec. It's about linking it to a problem that solves, it's linking it to a solution that solves a real problem for your organisation as a whole. So that's quite an interesting course. It's useful for anybody, as I say, on the front line, but it's also useful for you if you're an executive and want to consider how do you get workforce planning done across your organisation. So those are the different courses that you'll see turning up on this channel. Cool. Okay. So let's get into it. Let's dive into it, or skydive into it, in terms of the overview of workforce planning, what it is, and what on earth is going on. Okay, look, this is an online course recorded by somebody with a fairly dull voice and possibly an even worse face, which is, thank heaven for small mercies, that you're not able to see me as well. There's going to be a lot of blue boxes, and in itself, it's just going to give you the information. But there are various times when you might want to think about it before you move on to the next step. And this is one of those bits where you'll probably absolutely not do it. But let me ask you to do this at this stage anyway. It's worth thinking about, what do you think workforce planning is? Why do you think we need it? Think about what type of work you've been involved in and what you see getting in the way. Think about what you think the skills are, and think about the people that you need to get involved, and what impact there is if those people are not involved. So you might want to just think about that, pause and write those things down. Of course, you're not going to. We're going to move on to the next slide. But, hey, you can. We can wish. So the need to transform workforce is compelling. It's quite difficult to find a really good quote that sums this one up, but this is about the best one I found, which is the interim NHS people plan. There's a massive shortage of care workers, a shortage of nurses, medical staff, amongst many, many others. And these have been highlighted by any credible source. Predominantly, it's a factor of demand rising incredibly, largely due to a growing and aging population, but also a reduction in supply at the same time. You put those two together, reducing workforce supply, increasing demand, and you have an increasing gap between the two. So there is a massive need to solve what are becoming increasingly difficult workforce problems. On top of that, though, new processes, new care models, new technology, remote working opportunities, as we've seen through COVID, can fundamentally change the way we deliver care, but they all require people. But new roles, new organizational structures, different careers, new incentives, different value sets, these are all an integral part of that transformation. So, and I think this does kind of sum up that really. We need to look at this differently. We need to create a 21st century healthcare system. And I think we've got a massive opportunity to solve an enormous problem whilst grabbing hold of an enormous opportunity at the same time. So it is blooming well worth doing. Unfortunately, there are many, many barriers in the way at the moment. It is all but impossible to achieve because of those barriers at the moment, which I just want to make you aware of, just so you don't get disheartened when you get into the whole world of workforce planning. I've put an article on this on LinkedIn. You can get that through the Carados LinkedIn site if you're interested, which goes into this in a lot more detail. But certainly within the English NHS and social care environment at the moment, there are many barriers. The whole redesign transformation challenge is enormous for a start, bringing together health and social care, developing neighbourhood teams and integrating primary care. There are new pathways taking account of the remote working opportunities. You've got to integrate new technology like AI and say robotic process automation. And because it's enormous, teams are trying to do redesigns all over the place and for various different viewpoints. So there are some that are done on a finance basis, a quality basis, because demand is out of control, because process needs redesigning, because technology has been introduced. And in our case, we're looking to do redesign from a workforce point of view. Where we need to transfer an area because it's vital to our workforce agenda, there may not be a new care model in place, so we may have to do it ourselves. So there's a massive workload, and we need to fit that with all the other stuff, new processes, new estates, and new technology. But there are massive, complex organisational boundaries that are making that transformation difficult. Healthcare is a fractured mix of providers, commissioners, regional bodies. Social care works under a completely different set of rules to healthcare. So getting anything done at the moment requires long-term cooperation and often putting aside local rules, which is really, really tough for individuals to go through and certainly to sustain. On top of that, workforce planning skills are scarce. There used to be a lot of skills used in service managers in the NHS, in acute trust, but years of increasing demand and a need to chase RTTs and waiting lists has led to a massive atrophy of skills just when they're most needed. We really need an explosion of skills in frontline staff, service managers, team leaders, STP, ICS, ICP managers, regional teams, primary care practice managers, care homes managers. Everyone needs the teams to do this, and we need to build the capacity to lead this redesign. And we need the people to do it. Even with the skills and the tools, people need time to be able to lead that workforce redesign. people need to be involved in the groups, and no one's got the time to focus on it, especially with all these barriers in the way. We need help from analysts, from frontline staff to inform the change. Management need time to support it. So there is a real barrier in terms of not only lack of skills, but the lack of capacity to do it as well. Finally, just picking out another one. If we haven't aligned everything with the rest of the system, then we find that the way we did it doesn't align with what the regulators wants. And then finance have overwritten all the figures to make it align with the required finance picture. So trying to align what we're doing in workforce with the need of operations and finance is really quite difficult, because they're often working on different timelines and actually to aim towards different objectives. Getting this right is really, really tough, but we've just got to start. As I said in the previous slide, the reason for doing this is so compelling. We've really just got to get on with this. And just by starting it, we are starting to at least make a dent in it. So don't get downhearted by it. I'm going to talk a lot about workforce. We might even talk about resources. We might talk about matching demand with capacity. We might talk about playing with numbers on a system when we get to modelling. But before we go any further, and in this overview, just want to talk about, this is real people we're talking about. Now, obviously, that means treating the subject with respect first and foremost. But the other reason to think of people as people is that you've got to include this in the plan. Whenever you come up with a new model or a redesign process or role, you need to make sure that you are treating people like people, and that you've developed real human roles with career structures and incentives that make people enjoy their role and career. We need to understand that people are diverse, both the service users and the people in our workforce, and design our processes, our roles, our workforce around that. It is absolutely it's imperative. And when it comes to implementation, understanding that people have their own predictable and unpredictable behaviours is going to be absolutely critical. So if I do talk about resources and I do talk about workforce like I'm Data from Star Trek, then you need to think workforce is a real group of people. And if you're expecting references more up to date than the early 90s, then you're going to be sadly mistaken. So, workforce is multifaceted. One of the things I mentioned under the barriers, or showed up on the screen, was that workforce planning definitions are a bit difficult and can be a bit dodgy. So let's understand what workforce planning is. Health Education England define it as the support to the delivery of excellent healthcare and health improvement to the patients and public of England by ensuring that, we're getting into bold, the workforce of today and tomorrow, that's important, has the right number, important, skills, important, values and behaviours, important, at the right time and in the right place. That's a pretty good example. I think that's the best definition that I see. There are multiple definitions. People will talk about it under all sorts of different ways, but that is definitely a great way of looking at it. What we've done is split it down into 6 different skill groups as set out on the right hand side. I won't go into detail because we'll describe those in a moment. But workforce planning is about making sure we've got all of that lot in place. So why does it feel complicated? Well, because it can be done under lots of different timescales. I think this was originally, may even have been a monitor slide originally, but it's seriously adjusted over time to play in various different horizons for workforce planning. So it can be done on a day-to-day point of view. We can actually look at it and say, well, what gaps exist today? Given the people that are coming through the front door, does my workforce fit the acuity of those people? If I've got somebody missing today, do I actually need to fill it or not? So you've actually got a kind of a day-to-day look at it. Do I need to replace Jeff, who might have phoned in sick, or can I actually let Marjorie go home? Can I let Bandelli get on with some training at this point? Can I focus Gina on looking at a special project she wants to look at, or whatever else, or part of her development today, because I've got a gap. So there's a day-to-day kind of view. Typically, that's a sort of quick skill mix review and the use of potentially use of overtime or temporary staffing if we are short. Thinking, do I need to bring Amina in to cover this shift or whatever? Then we're into Horizon 1, which is your short-term operation, which is less than a year. And this can be done, monthly, quarterly. It can be done bi-weekly or whatever else. Looking at how do you best deploy your current workforce, and how do you fill gaps caused by people leaving or saying they're going to leave, or people getting more and more skilled. How do you fill those gaps behind, for example? It's driven by things like looking at headcount projections. It's driven by rotas, by scheduling and day-to-day management. So there's a sort of a less than 1 year horizon. There's also a medium-term horizon, which I tend to look at as sort of like the 1 year kind of horizon. This is when you look at things on a much more sort of annual basis and think about what do we need in the current year to accomplish our strategy. This fits within sort of annual budgeting processes really well, but it allows you to think sort of beyond the sort of more knee-jerk reactions a little bit into a real focus around what do we need to do from a training, professional development, some sort of small-scale recruitment that we might to do, performance management that we might need to do, etc. Linking with sort of annual reviews and the like. So there's a whole sort of timescale there. And then there's a sort of a longer term strategic timescale where we're really looking at the strategy of the business and understanding what do we need to accomplish those long term businesses strategies. This is when you can look at stuff like, do we need to train more nurse endoscopists, for example, which can typically be a sort of 5-year window. But really thinking about, what is going to happen to my business over 5 years, my team over 5 years, and what skills am I going to need over that period, and how can I steadily move my current team and any future team towards that. So you can look at workforce planning even in a team from sort of a very day-to-day to very long-term strategic. On top of that, you look at the sort of 10-year stuff that gets done by HEE around, I need to really work out what's the health sector going to look like, and then consider what's the staffing need to look like to make that work. How do I recruit? What new roles might I need? And then you're into some really mind-blowing timescales. So not only can it be done from short to strategic timescales, it requires different skills at different levels. And I typically end up putting people into 3 different buckets. So you've kind of got your operational bucket, which is typically where your service and practice manager need to get involved. It involves everything from scheduling and rostering, day-to-day management of sickness and absence, management of people, leadership, etc. It's a core part of service and practice manager or team leader skills to be able to basically develop your team to meet demand. And that normally has to be done for a fixed cost. So that's your sort of first bucket. The second bucket is more sort of like the annual redesign bucket, which involves the same people, but also includes HR, ops, and finance people who have to sort of prepare an annual alignment of demand, staff, and budget. You often need to redesign to implement a cost improvement plan or new service requirements, deal with steadily increasing demand, or deal with workforce shortages. So this is where you're really bringing in the skills of redesign, demand and capacity planning, workforce modelling, etc., on top of those sort of frontline skills. And then finally, you've got strategic planning. So, if you're an STP, an ICS, or an ICP, or you need to work across systems, this is all about how do we plan to communicate to stakeholders, patients, service users, staff, regulators, national and regional ops structures. You're going to need a whole lot of strategic planning skills coming into play. You're going to need to develop physical plan documents, which you probably wouldn't have had to deliver up until this point. Strategies and the like. You're going to need to build strategic responses, link in plans with ICS and STP governance system redesign. You're going to need to work out how you can build capacity in your system, etc. So I tend to put things into three key buckets, three key projects that I tend to get involved in. A very operational one, more of an annual planning one, and then a much more strategic one, normally involving workforce planners as well, as you really get into that kind of space. So you can end up with not just different levels, but you can end up with different skill sets being required in those different levels. So we talk about 6 categories of workforce planning and skill, which I'll go into a little bit more detail on, but cover briefly here. So the first category is this operational management skills, that day-to-day stuff. And then there's a whole redesign piece, which you can split into 3. You can talk about having to redesign the entire system as well as workforce. You can have specific skills around workforce redesign itself within a system redesign program. So how do you actually do that workforce redesign, which is great if you're actually part of an overall system redesign. You can just focus on that. And then you need the skills around workforce modelling itself, either with or without WRaPT, and we can talk about those skills. That's the redesign set of 3. Then you need specific skills to deliver a plan, and then you need specific skills to deliver and develop the sort of infrastructure you need for this strategic stuff at ICS, SDP, ICP sort of level. So those are the 6 categories of workforce planning skill that we train in and that we'll cover throughout these various courses. So just talking about each one in turn, operational management focuses actually a little bit on everything, but is mainly around these skills here. So the skills we're going to focus on are around scheduling, time and attendance, managing sickness and absence, coaching and mentoring, leadership, communication, change management, HR process and policy, and budgeting. But we'll also talk a little bit about some of these other things that you need to play into any of that conversation as part of a bigger discussion. But operational management is these skill areas we're going to focus on. And it's basically going to focus on getting 4 outcomes. You're going to deliver a quality output. You are going to offer some great customer service. You are going to build an excellent and a happy team. And you are going to meet your budget, and that is really what we focus most of the time on. Is delivering those 4 things, and that's the area of operational management. The area of workforce redesign and workforce modelling, as I say, you kind of need to understand a few different elements to it, and we've talked about those 3 parts. So we're going to talk about system redesign. We're going to talk about the fact that when you come to a problem, you may need a project to solve the problem, including workforce. What I mean by that is, if you've got a workforce shortage, the answer is not just going to be about workforce. It's going to be about, can we replace some of them with technology? Can we look at the estate so that we can optimize workforce? Can we look at the organization structures and the like? Can we look at the process that we follow to try and reduce or change the need we have for staff? So that may have been done, but it may not have been done. So you're going to need some system redesign skills that consider all of those different elements of part of what we're doing. What we then might also need to do is sort of the specific workforce redesign itself. And this is really looking at the requirements of roles to understand whether we can come up with new or amended roles, different roles, and whether we can move work between roles. And that is a very specific, absolutely detailed workforce skill that we're going to bring in. And then we're going to talk about workforce modelling as a specific. And workforce modelling is about, realistically, is the ability to match demand with capacity and understand the relationship between demand and capacity through this thing that we call drivers. So workforce redesign and workforce modelling is going to see 3 sets of skills developed: system redesign, workforce redesign, and workforce modelling, capacity and demand modelling, which is absolutely a critical part in the middle. Now, when it comes to redesign and modelling, there are lots of different approaches already out there. So we call this one WRaPT Redesign, which you may or may not need to use a WRaPT tool for, but it's just a name we can use. It's a free tool to be used, and it's a fairly light, pragmatic approach, which is quite helpful, we think, because you can actually use it alongside anything else you decide to use. But there are many, many other approaches out there which have got slightly different bases and nuances to them. One we are going to talk about a lot is the excellent Health Education England STAR model, which we actually use as part of our WRaPT approach. We use the STAR repository as part of it. But STAR as an approach is a light workshop-based approach which gets you very, very quick results, and it's a great light approach. Another one we will talk about is CLEAR, which is delivered by a company called 33N. It's a Health Education England program, and it's a very data-rich, clinically engaged education program, which includes a redesign approach called Delta. If you want training in that, you need to go through HEE and 33N, but it is a great tool for engaging clinicians. Can take quite a long time, 3 months for the projects once you are trained, 6 months for the first project as part of the education at the moment. So it's very much on the other end of HEE spectrum of quick and easy. This is really focused on quality outputs, engaging clinicians and education, but it's much longer burn. From the HEE stable, you also have the 6 steps model, which is delivered by a company called Skills for Health. 6 steps is a great approach. It typically relies on having a care model in place already, and it starts with the care model and then thinks about the future state. It can be quite freeing. Whereas in WRaPT, we look at the current state first and then move to the future state. It's a nice little approach where there is a lot of online training if you are in the English NHS, and is one well worth looking at. Sort of fills the gap in the middle between CLEAR and HEE. And if you plan on using 6 steps, there's nothing wrong with learning the WRaPT approach as well, because WRaPT, as I say, includes this kind of overall program project approach. And has lots of bits of learning that you can apply if you are also using the 6 steps approach. Then there's a whole range of other ones out there. There's the Recipe for Workforce Planning from the West Midlands. HEE again, not used as much anymore, but certainly still out there. You've got the population-centric model, which delivered by Gold Consulting, I believe. I spoke to them. Love the way it places the patient right at the centre of redesign. You've got Calderdale Framework, which I believe is Effective Workforce Solutions, delivers that, EWS. Again, I've seen that used to great effect, places like Sheffield and others, and obviously in Calderdale. A very data-rich approach to redesigning your workforce and process approach. Another great little one. There's approaches like Swipe, which again is another specific workforce redesign one, helps you to get to a future model. And there are various other frameworks within the sort of specific workforce area. On top of that, Lean as an approach, the rapid improvement event type approach of Lean or Six Sigma or theory of constraints or Simulate or whatever else. You can use Vital Signs, which is the redesign approach that NHS I&E are using at the moment. They all give you some great approaches to redesign, which can include workforce. I hope you've picked that out, that workforce fits within process, technology, with organisation, within facilities and estates, to form an overall view on a redesign, and those redesign methodologies can be used to help with the redesign. So that's workforce redesign, modelling, system redesign covered. What about the plan itself? I've already talked about a lot of these, so I'm not going to go into a vast amount of detail on this one. The workforce plan is a set of skills you need to actually engage people in coming up with a clear view on what we're actually going to do. And it is of vital importance as far as I'm concerned. It's not just writing down what you plan to do. This is about trying to engage people in understanding, look, we've got a problem. Look, this is what the problem is. Hey guys, we've come up with a view on how we might address that problem. And this is how we're going to do that from start to finish. It's a way of engaging people in developing that document, which engages them in being part of the delivery of that plan. This is an approach to delivering a workforce strategy or a workforce plan. And I think this is particularly useful for ICPs, ICSs, STPs. Because we've done a few of these already, it's quite a helpful, I think, sort of, it's a helpful set of things to think about when you're actually putting together a plan. We're going to talk about what one might look like. We're going to talk about what things might be in it. But it's that considerations bit again that I particularly like. It's really helping you to understand why on earth are we actually delivering this plan. We sort of use the redesign approach a little bit for the plan because it is certainly well worth understanding your current state, your future state, your plan, etc. So we go back to some of the elements of that. But being able to develop a workforce plan is absolute critical skill. We won't go in the specifics of writing skills, etc., but we will go into how do you write a plan from scratch. And then, yeah, that will cover all sorts of different things within it. So it will cover the background and all the things you need to know to understand, to build your background. It will talk about what's currently going on and all the things you can do to find out what's currently going on. It will talk about what we need to move to and then how do we get from A to B. We'll talk about the need for the compelling business case, the detailed plan, what that might include, the support details around it, the metrics, the communications, etc. So there's a whole lot of stuff to discuss with that plan. And it does then lead us into the hub. This you'll see as a source NHS improvement. It's from the first iteration of the SWIM System Workforce Improvement Model. And we will talk about the skills required for building the infrastructure and engaging support to the kind of what we call the Hub Plus approach. And this is really about all of the different tasks you get asked to do or are being expected to do at an STP, ICS and ICP level. The regions will be asking for it, the centre will be asking for it, your individual organisations and ICPs will be asking for it. And this is about grabbing hold of that agenda and proactively looking at what you want, how you want to manage workforce as a system. How do you engage the ICP and engage the TAMs, spelling mistake number 2, engage the teams to actually help you develop the plans and deliver them. So that's the set of skills, and that is pretty much this overview course finished. What are the next steps? Well, you can have a look at the WRaPT tool if you haven't already done so, or register it using that link there. https this is .rapt.org.uk, or you can visit the WRaPT website, www.rapt.org.uk. You can buy the bumper book of Health and Care Workforce Planning, which should soon be available in all good bookshops, or at least on Amazon and various online bookshops for order. That includes all of the information that we have on in the team on health and care workforce planning, and truly is a bumper book. You can visit the Health Education England workforce planning pages, which helps you gain access to some of the tools. You could visit the Carados website if you want to look at more management training and resources. Certainly if you want to look at the other areas like cost reduction and customer service. But hopefully what you'll do next, having looked at this overview, is you'll start one of the courses and the ones we mentioned. So you'll either start WRaPT Redesign, start WRaPT Plan, WRaPT Hub, or WRaPT Frontline, and have a look at those. And we will soon get those courses up in this distinctive and exciting blue boxy design pretty soon. So hope that's been useful. Leave your comments, share, and do all the other stuff.